So welcome everyone. Thank you for joining us today. Before we begin, we just want to say thank you to everyone involved in the healthcare systems, and we hope that you and your families are staying healthy and are able to stay safe. So we're all here today because the final rule dropped recently, and we have been working with the Office of the National Coordinator, ONC, on what this means for the developers. And so we put together this 5-part webinar series breaking down the final rule. For those that are not aware, there are 4 other webinars planned next month. We are doing them every Tuesday in May. It's at the same time. You can register for those on our website or use this direct link. We're also going to post the slides and recordings on our resources page as well. So if you're not able to attend any of these, we will have those on our website. So in this first webinar, we're going to give a brief overview of the changes to the 2015 edition testing and certification program. We'll talk about the new, the revised, and the removed criteria in the 2015 edition. And we're going to talk about retiring of the 2014 edition. We'll also discuss the conditions and maintenance of certification, this year's requirements for developers, some critical timelines that you should be aware of, and then ONC's broadening scope. And then we're going to wrap it all up at the end with a Q&A session from questions submitted during the webinar. I'm Melissa Martin. I'm your host today. I have with me Sonia Galvan. She's our certification program director. She's our main speaker. She runs our certification body. Timothy Bennett is also going to be on the line, our test lab director. He's going to be fielding questions during the webinar and answering them live. So please submit as many questions as you need. He's also hosting 2 webinars next month regarding just the test criteria. So he's going to really deep dive into those topics at that time. So any questions that aren't answered during the webinar or in the Q&A session at the end, we're going to answer via email. So again, please submit as many questions as you need clarification on, and we're also going to be available via email to answer those as well. With that being said, we have a lot to talk about today, so I'm going to go ahead and hand it off to you, Sonia, to talk about the key elements in the final rule.
Hi, thank you, Melissa. And let me start by extending the thoughts and well wishes from the Drummond team to each one of you during this very critical time. We greatly appreciate your attendance today. So as you all know, the highly anticipated 21st Century Cures Act final rule was released last month. Some key elements incorporated throughout the regulation include a focus on patient first, giving patients more power in managing their own care and enabling access to their health information. And in line with that, throughout the regulation, the need for data sharing and interoperability is highlighted, and supporting access, exchange, and use of electronic health information, or EHI. We see this through rulings such as the enhanced API requirements in efforts to enable patient access to their health information without special effort. Also, due to serious concerns surrounding information blocking, the ONC has put forth efforts in defining what this is and setting enforcement mechanisms in place to prohibit information blocking. So the ONC recently verified that the final rule publication date to the Federal Register will be on May 1st, 2020. And the regulations effective date will be June 30th, 2020. So compliance timelines, they do vary across the new and revised criteria. So we are going to touch on many of these today, and we'll provide a table towards the end of the webinar highlighting some of those, as well as requirements for developers beginning this year in 2020. For Drummond clients, we will continue to provide you guidance on these compliance dates by way of newsletters, additional webinars to make sure that you stay informed. Now, many of you may have read about the enforcement discretion announcement from ONC last week. Due to the impact of COVID-19, ONC announced that they will be exercising discretion in enforcing new requirements based on 3 months after the initial compliance date. So it's important to note that any compliance date stay in the regulation will remain in place. However, if a developer is late up until 3 months, it will not be held as a nonconformity for them. So ONC is not characterizing this as a deadline extension, but rather an enforcement discretion. So as we go through the webinar, we'll be citing compliance dates that are stated in the final rule, but keep in mind, again, enforcement discretion will apply. All right, so as Melissa has stated at the onset, this will be a high-level overview of criteria and certification requirements. So we are going to touch on some important points of the new regulation, but we will be taking a deeper dive as part of our upcoming webinar series, so please be sure to sign up for those. The finalized changes to the 2015 edition, it will require action from certified developers. So while a full recertification is not expected, all developers should expect to make some updates in order to align with the new regulation. So to begin, let's start with new criteria B10, electronic health information export. So this criterion will be replacing the the B6 criterion data export. So under B6, the patient data is pretty well defined. It's contained in the CCDA. However, under the new criterion B10, ONC is expanding the scope of the patient data that's being exported. ONC finalized this criterion requiring a health IT module to electronically export all EHI that can be stored at the time of certification. So the EHI definition, it includes health information that's created or received by a healthcare provider, and those operate on their behalf. So it's not limited to information created just by the healthcare provider, but it also includes data from things such as external labs, imaging systems, data warehouses. It may also be provided by directly from an individual or from technology that an individual has elected to use. Information on the individual's insurance eligibility, billing for healthcare services, payment information, which may also include price information. So the EHI definition is similar to the electronic protected health information a patient would have access to in accord with the HIPAA privacy rule. Now, these certified health IT products will need to support a single EHI patient export. And in this case, a user must be able to perform the export at any time that they choose and without developer assistance. The health IT product also needs to demonstrate a patient population EHI export. Now, this action could be performed with developer assistance, and this one is intended to support transitions between health IT systems. The requirement also specifies that exported files must be an electronic and computable format. Developers will have the flexibility to determine the product standard format and will need to make this available via a publicly accessible link, including the exports format along with the exported files. Another significant change under B10 is the fact that this will now apply to any certified health IT product that stores EHI. So some health IT products that were not originally certified to B6 data export will need to come back and obtain certification for B10. By May 2023, which is 36 months from publication date, developers will need to comply with the B10 requirements and must provide all its customers with the health IT certified to this criterion. I also want to note that the EHI definition, it's related to the info blocking provision in terms of what needs to be shared, and we're going to touch on that briefly later today and also in our subsequent webinars. Two new privacy and security criteria have been adopted. D12 encrypts authentication credentials and D13 multi-factor authentication, or MFA. For D12, developers should attest yes or no if the product encrypts stored authentication credentials. And for D13, attest yes or no if MFA is supported within the application. The ONC has clarified that it does not require certified health IT to have these capabilities or for developers to implement these capabilities. So developers will be expected to attest based on current implementation and will not be required to have any additional development for these. But keep in mind, so if you are testing no to either of these, it's not a negative impact on your certification. These criteria may be an indication of future rulemaking. ONC may expand them later, but for now, just to attest whether you support these features. Also, developers will be provided an opportunity to explain why they do not support any of these features. Just as an example, perhaps authentication is performed by a third-party service or something similar to that. These criteria will apply to new certified products and must be tested at the time of that initial certification, but also for those who are already certified in 2015, including privacy and security. If your product is going through revisions, modifications, and is presented for recertification, your product will be subject to comply with these two new criteria. Now, the final compliance date for these will be within 24 months of publication, or also May 2022. G10, standardized API for patient and population services. So another new criterion, and this one will be replacing G8 API data category request. ONC established this new criterion for developers to support two types of API-enabled services based on a single patient data and also based on multiple patients' data. It is limited to API-enabled read services using FHIR Release 4. So there are a number of new standards, implementation guidelines, security requirements to adhere to for this criterion. They are aimed at supporting standardization and interoperability, but these will be addressed in our later webinar. Also, the ONC will be utilizing a new tool called Inferno, a preview version of both the Inferno test tool and the ONC test procedure for G10. They're both now available via the ONC 2015 edition test method page. And also similar to current requirements, developers will still have to publish their API documentation via a publicly accessible link. The compliance date for this criterion, again, is 24 months of publication, which is May 2022. So please note that we're going to go over some revised criteria. And on the next two slides, these revised criteria have a compliance date of 24 months from publication. Again, so here we're seeing the varying timelines. So we just want to clarify that for the revised criteria. For e-prescribing, ONC finalized that this is an update to the current B3 criterion rather than creating a new B11 as was proposed. So the revised B3 criterion includes an update to the NCPDP script, version 27071. And this has new transaction types. There's many new optional transactions. So developers will be required to update to the new version of the NCPDP standard. Also for those developers who are already certified, you will need to also apply for inherited certification status through your ONC authorized certification body or your ACB. So you need to apply for that inherited certification status to maintain your certification to B3. For Drummond clients, we'll be communicating instructions of how to do this very soon. So stay tuned for that. So as sort of noted earlier, the compliance date at 24 months of publication. So developers will have to provide this to customers by May 2022. For your reference, the draft ONC test procedure for the revised B3 criterion is now available for preview on the ONC test method page. A draft version of the test tool is also available within the NCPDP e-prescribing test suite. Keep in mind, a finalized test tool will be available by the effective date of the rule, which is on June 30th. And as a side note, this is external to the ONC certification program, but is relevant for any developer who maintains any PCS certification. DEA federal regulation requires a recertification when updating to the new NCPDP standard, as this results in a change to your ePCS functionality. So if you have your own ePCS certification, you will need to recertify, or if you're using a third party for your ePCS, you will need to have an integration review performed. So any questions about this, please do contact us. You can reach us at epcs@drummondgroup.com, and we'll be able to help you stay informed. In regard to data segmentation for privacy, the ONC did not adopt two new criteria as proposed, but opted to revise existing criteria B7 and B8. They were renamed. They are now known as security tags, summary of care, send and receive. So two separate criteria. These include the full scope of the DS4P standard for supporting security tagging at the document section and entry levels. It was based on a more granular approach they were taking. Some valuable information will continue to be shared regarding these particular criteria in our upcoming webinar based on revised testing criteria. As an additional note, B7 and B8 are still identified as voluntary criteria, meaning they are not required for CMS reporting, nor are they part of the ONC-based EHR definition. For B9 care plan, the primary change is to update to the CCDA companion guide. So for developers whose current certification includes B9 care plan, just be sure that you're updating to that CCDA companion guide and provide customers within 24 months of publication. Again, May 2022. For C3, CQM reporting, the ONC removed requirements that do not support quality reporting for the CMS program. Therefore, the revised C3 criterion, it now supports the CMS QRDA implementation guide and no longer the HL7 implementation guide. And keep in mind also that criteria C1 and C2, those remain unchanged and still required to export and import based on the HL7 QRDA Cat1 files. So it's only C3 that was being revised to require the CMS implementation guide. Cypress version 5.4, it will support the Cures Act final rule updates and has a plan released for May 14, 2020. So keep that in mind. The revision for privacy and security criteria. So this pertains to D2, D3, and D10. So the change was based on the updated ASTM standard. I do want to note here that we did receive actually a few inquiries regarding this, specifically about the duration of access requirement within the updated ASTM. We did pose this question to the ONC as it was initially relayed perhaps as an insignificant change in the rule. However, this additional layer of auditing requiring an additional date timestamp related to duration of access, it may pose a major change for some developers. So just FYI there, so we are waiting further clarification from the ONC, and we'll be sure to communicate these to the clients as soon as we get that information. USCDI for CCDA. So USCDI is the United States Core Data for Interoperability. And in efforts to advance interoperability, ONC finalized to remove the Common Clinical Data Set, the CCDS, and replace it with the USCDI version 1. The final rule explained that the USCDI establishes a minimum set of data classes. These are required to be interoperable and are designed to be expanded over time. The new data classes and data elements that were added to what's currently in the CCDS include clinical notes, provenance, patient address and phone number, and pediatric vital signs. The ONC noted that the updates from the CCDS to the USCDI were intentionally limited to a modest expansion. So it does not include new functionality, nor should require a complete redesign of your health IT product. Also, as part of the new requirement, the ONC is requiring the use of the updated CCDA companion guide. So developers should notify their ONC ACB on the date at which they reach compliance, and we'll be providing instructions on how to do that for Drummond clients. Developers with Health AT certified to the CCDA related criteria, which is there on the slide, prior to the effective date of this rule, will have to update their products to USCDI and provide the updated Health AT product to all customers, again, within 24 months. And just as a point of reference there, the USCDI version 1, it can be accessed via the link provided here on the slide through the Health IT Gov website. In terms of revisions, we wanted to make mention of the new standards version advancement process. ONC established this process to improve the pace in the market, and so this flexibility will allow developers to move to new standards and not have to wait on regulation published by the ONC. So developers will be able to voluntarily update their products to any new ONC approved standards, versions, and implementation specifications while still maintaining certification. So they'll have to attest to their ONC ACB if they decide to update to the new standards. And additionally, any new version of standards attested to should be a part of the developer's real world testing. And we'll talk a little bit about that in just a moment. And just as a final note about revised criteria, we expect to have test procedures from the ONC by June 1st, and test tools are expected to be finalized and available by June 30th. So ONC finalized to remove some criteria from the current 2015 edition program. These were selected based on consideration that EHRs should already have these capabilities. Now, EHRs are still expected to maintain these capabilities, just no longer require separate certification. So as noted here, there will be 6 criteria that will be removed from 2015 edition. These include problem list, medication list, allergy list, smoking status, CCDS, send and receive. And just as a reminder, problems, medications, allergies, smoking status, those are also required within the USCDI. So again, just no longer required to be separately certified. Additionally, the ONC will update chapel listings to reflect these as removed. And so this should occur around the same time frame as the effective date of the rule. Also, there were additional criteria identified to be removed, but at a later date in order to accommodate the Medicaid Promoting Interoperability Program. So the first 3 criteria listed will be removed from the program effective January 1st, 2022. These are drug formulary checks, patient education, and secure messaging. As noted earlier, the G8 API data category request is being replaced. So this criterion will be removed effective May 2022, again, 24 months after publication. As an additional note, the base EHR definition will be updated to allow allow G8 or G10 up until 24 months post-publication, okay? And B6, data export. So that's also being replaced by new criterion. And for this one, it will be removed from the program 36 months after publication or May 2023. As part of mandatory disclosure requirements, the ONC has removed the transparency attestation and disclosures of technical limitations. So specifically for the technical limitations, ONC believes that those will be addressed as part of the conditions and maintenance of certification. Therefore, having these disclosures remain would be redundant. So any limitations to access, exchange, or use of health information, electronic health information, that will not be permitted. So ACBs will no longer be collecting these 2 types of disclosures as of the rule's effective date, June 30th. Now, the cost transparency requirements will remain in place. So developers will still have to submit disclosures on the types of costs or fees a user might be required to pay in order to implement or use the health AT's capabilities. Where applicable, any inclusion of description of fees for third-party services, that would still also apply. We will be reviewing these changes in further detail. Again, our upcoming webinar focused on certification and highlight some of the expected changes developers will need to make in order to comply and to remove marketing communications about any current limitations, as well as timeframes to do so. So this table, it summarizes timelines for new criteria, revised criteria, and when criteria will be removed. This is based on just what we discussed in previous slides. So effective June 30th, testing will be available for new and revised criteria. And please note that all ACBs are still actively working with the ONC for final planning and guidance. So for Drummond clients, we will be sure to communicate when we can begin registering once we have those plans finalized. As noted here, timelines when developers should be certified to new and revised criteria. So as we mentioned, publication date, May 1st. So here we have the 24-month and 36-month period ending May 2022 and 2023 respectively. The footnote references the enforcement discretion period we touched on earlier and how this applies to the compliance timelines. As we all expected, the ONC will be officially retiring the 2014 edition. And as we know, the 2014 edition is, that criteria is no longer used by any CMS program and hasn't been for some time now. So ONC will be updating the Chapel website to change the status of these to retired. And that should align with the effective date of the rule. And retiring of 2014 will look much like it did for 2011, how that was handled, in that the Chapel will continue to maintain a listing of the health IT products previously certified to 2014. Also, ACBs will cease all certification activities for 2014, including surveillance as of the effective date. And developers of 2014 edition will need to remove statements of certification related to the edition from their website and marketing materials. So again, Drummond will be providing guidance on this to our clients on removing seals, marketing information, and when you need to comply with this. So again, another point for discussion during our certification webinar, which will be on May 26th. And finally, since 2014 edition will be retired, this changes the GAP certification process. Some of the GAP criteria is actually being removed under the final rule, but for those that remain, developers will now be able, will just self-declare to those. So no longer requesting GAP certification.
Great, thanks, Sonia. We all appreciate the overview on the testing changes. And again, to reiterate, we are having several other webinars on the real world testing and 2 on specifically just the test criteria. So we'll go over that even further. So let's move on to the continued certification compliance. And since that's such a major focus within the rule, Sonia, will you provide more information on the certification aspect?
All right, thank you, Melissa. So in continuation to enable data sharing, ONC established conditions and maintenance of certification. So these are very important requirements for all developers. It clarifies certification requirements, initial certification, and then ongoing. If any non-compliance to these conditions or maintenance of certification are found, these would be subject to ONC direct review. So ONC will be involved with reviewing any violations, and if any are found, it could come with consequences such as suspension, certification termination. So we want to make sure that our developers are staying in compliance. So to provide guidance and specifics to developers, most of the conditions have a subset, which is the maintenance requirement. Now, one of the main conditions of certification is related to information blocking. So probably the main one, because it's emphasized throughout the rule. And as evidence of that, if anyone has attended the ONC webinars, the first 3 out of 4 webinars was centered on information blocking. So again, emphasizing the importance of that. So in total, there are 7 conditions of certification. So information blocking, real world testing, APIs, communications, assurances, attestations, and the EHR reporting criteria submission. So we're going to talk about these today, but again, this is a high-level overview, but we're still going to provide some detail. But please, again, look forward to our May 26th webinar. We'll have a bit deeper dive. So to provide an overview of how the conditions and maintenance are structured, first of all, we'll look at the information blocking requirement. And this prohibits any health IT developer from taking any action that constitutes information blocking as defined by the law. And the final rule has defined what information blocking is, and it identifies use cases where it may be reasonably permitted. Overall, the EHI must be made available for access, exchange, and use without special efforts. The regulation also defines 3 categories of actors: providers, developers, healthcare information networks. It also identifies consequences for violations. There are 8 exceptions to the information blocking provision. A few examples: withholding information, maybe that to prevent harm to a patient, health IT performance, licensing fees, and more. While compliance to the new regulation for information blocking does not take effect until November 2020, 6 months post-publication, compliance is still highly encouraged now and has been, especially during this preparation period. The second condition of certification is real-world testing. ONC stated the objective of this is to verify the extent to which deployed health IT products in operational settings are demonstrating compliance to certification criteria. So developers will have to test their product in the production setting in which it'll be used. And this applies to interoperability related criteria, which are listed here on the screen. So there are quite a few. And this will be an annual requirement to submit test plans and test results to your ACB, and ultimately this information will be posted to the ONC Chapel website. So developers will be required to submit the real-world test plans to their ACB prior to December 15th. We're going to show you a timeline in just a bit to give you an overview of this, but December 15th is the date that the plans need to be submitted to the ONC. Test results, they need to be submitted prior to March 15th. It's in 2022. So Drummond will be communicating specific due dates to clients once the rule is effective. So we'll make sure to keep you informed there. Also, to clarify, the test plans that are submitted this December 2020 will be for testing that occurs in 2021. And then the test results for that should be submitted to the ACB by March 2022. Also, as part of real-world testing, it's important that developers report any non-conformities discovered in the course of conducting the real-world testing. They're required to report within 30 days to their ACB, again, if any non-conformities are found. Just a reminder, again, our webinar is scheduled for next Tuesday, May 5th. This will be focused solely on real-world testing, so we look forward to providing you more details on this. Additionally, Drummond is excited to introduce a new service line. We will be offering to assist with this real-world testing requirement. So again, details will be presented in our webinar for next week. Now, the ONC stated that the API condition of certification. So this was established to address circumstances related to the use of API technology, including certified API developer business practices. So this condition addresses ongoing requirements that must be met by the developers and their API technology related to transparency, fees, openness, and pro-competitive behaviors. For the maintenance, the certification requires to remain consistent with the scope of the authenticity verification and registration. And this requires instituting a process to verify authenticity and have that completed within 10 business days. And then to register applications within 5 business days of completing the verification. Also, service-based URL. So this is to publish for customers of APIs so patients can access their EHI. And then compliance to rolling out G10. That's a compliance date by May 2022. In regard to communications condition of certification, the ONC has stated that health IT developers must not prohibit or restrict communications about certain matters. This includes usability of health IT, interoperability of health IT, security, user experience, business practices related to exchanging health information, and the manner in which a user has used such technology. So developers are permitted to impose certain types of limited prohibitions with the need to protect business interests, but the regulation provides further guidance on this and specifics in terms of what types of communication is prohibited. And please note, this condition for communication, it impacts all developers of certified health IT. Now, as part of the maintenance for this condition, developers whose contracts currently include any GAD clauses, so a change to the contracts will be required. Developers will need to notify clients by written notice that GAD clauses or any agreement that violates this condition of certification will not be enforced. So this notice will have to go out to customers annually until contracts can be amended. And additionally, the maintenance goes on to require that there's no permitting, any establishing of renewing, enforcing any contracts that contravenes the ruling. So, important update there. In regard to the assurances condition of certification, developer must provide assurance that they will not take any action that constitutes info blocking. Also, take any action that could interfere with the user's ability to access or use certified capabilities. Also, developers must assure their certified health IT product conforms to the full scope of certification criteria. And if certified health IT product does electronically store EHI, then we'll have to assure that meeting the certification requirements to B10, that will be required. As part of the maintenance for this condition, the developer will need to retain records and information necessary to demonstrate initial and ongoing compliance with certification for a period of 10 years from the date the product was first certified, as well as 3 years after the retirement of an edition. Also, a developer must provide all customers health IT certified to B10 by May 2023. For attestations, developers will be required to attest that they comply with these conditions that we just discussed. Which would be info blocking, assurances, communications, API, real-world testing. So this attestation will be required when initially certifying a product. So ACBs will not be able to issue certification without this. But then also for those who are already certified, this maintenance requirement would include submitting an attestation twice a year, testing that the product still meets conformance and has met conformance for the prior 6 months. So there will be a 30-day window to submit attestations, and that opens up on April 1st, 2021. So this attestation for April 2021 will cover the compliance period starting with the effective date of the rule, which is June 30th, 2020, through March 31st, 2021. ONC is expected to provide a method for developers to report to ACB for the attestation. So we look forward to sharing that information with you and should have that by our May 26th webinar date. For EHR reporting criteria submission, so this one ONC announced it would be future rulemaking. Once that's ready, they would undertake rulemaking to propose and implement a related condition. But as of today, it's not complete. So this slide highlights the requirements developers will need to meet in 2020. I also want to remind you here the enforcement discretion period. It's included in the footnote. So these compliant dates based on the regulation, they remain the same for developers who are able to, should comply with these dates. But for those who are unable to, due to impacts from COVID-19, the discretionary 3-month period is available. So effective, beginning on June 30th, the compliance period starts for developers for assurances to ensure that their health IT conforms to the full scope of their certified criteria. Again, this is what we're going to be attesting to come April 2021. Also, a compliance period for communications starts. So the developers will not prohibit or restrict communications. Again, we touched on this earlier. And as mentioned, there are permitted prohibitions and restrictions. Please do see the ONC's final rule section 170.3 for more details on that. Beginning in 2020, we're on that second row there, communications. So as we discussed, beginning in 2020, developers will have to provide written notice to customers that any contract that contravenes the ruling, such as a gag clause, will not be enforced. And again, that notification will be required annually until the contract can be amended. Compliance date, 6 months post-publication for information blocking. Effective 6 months after, developers will need to comply with information blocking with the limited EHI definition. So EHI be identified by the data elements represented in the USCDI. So USCDI will be the baseline for EHI. The ONC has finalized an incremental expansion. So the full EHI, that will be required beginning 24 months post-publication. So for 6 months, it's the limited EHI definition. Also, for assurances, developers must begin to comply to assure the actions and behaviors do not constitute info blocking or inhibit accessing, exchange, and use of electronic health information. Also, API compliance, we're still under the 6 months post-publication. Developers currently certified to G7, G8, or G9 will need to update policies and revise existing API documentation in order to comply with section 170.404 of the final rule. This includes revising existing business and technical API documentation, terms of use. There's information and guidance on API fees, and then of course making that documentation available by a publicly accessible link. And then finally, prior to December 15th, 2020, real-world test plans will be due to your ONC ACB. The final rule touched on the fact that ACBs will need time to review and submit these plans. So that is why the due date will be prior to December 15th. So Drummond will impose a due date likely in early November. Again, we'll be sure to communicate that to you once that's been finalized. And lastly, here in the footnote, again, the reference to the enforcement discretion period. If any of you have attended any of the ONC's webinars, you'll recognize this slide. We wanted to provide this as an additional point of reference. The ONC certification timeline, it highlights timelines throughout 2023. And you can find this on the Cures Act final rule page, and the link is provided below. And finally, we wanted to touch on how ONC has begun a broadening of scope. Here are just a couple examples of that. For patient matching, ONC recognized that this is a barrier to interoperability. Based on industry feedback, they finalized additional data elements in the USCDI, including previous address, phone numbers, email. And additionally, in the proposed rule, ONC included an RFI seeking comments on opportunities in the patient matching space. So potentially something we might see in future rulemaking. Also, the Cures Act included a provision to make recommendations for a voluntary certification of health IT for use by pediatric providers. So the ONC conducted research work, a lot of analysis was put in, and they identified existing criteria under the 2015 edition that could benefit pediatric providers. So the voluntary pediatric program, it's not a separate program. Again, they've identified existing criteria to use for pediatrics. Now, as part of their continuing efforts, they also intend to release a pediatric health IT developer informational resource, and also a pediatric health IT provider informational resource. So that would assist with implementation, and I believe that's expected later in 2020. And in line with that provision related to supporting pediatrics, the inclusion of pediatric data elements in the vital signs data class of the USCDI was finalized. We touched on that a little earlier. Now, on a related note, Drummond, along with a group of very highly experienced stakeholders in the pediatric health IT space, we have recognized a need for this specialized certification program. Therefore, we are pleased to announce that Drummond is in the planning phase for a new voluntary pediatric certification program. So this certification program will be outside of the ONC certification program. But yet our aim would still be to align with the recommendations already set forth in the rule, along with other requirements based on the children's EHR format. If anyone's interested in participating in this planning in our work group, please feel free to reach out to me directly, sonia@drummondgroup.com. We certainly look forward to having you. And finally, to wrap up for today, so we want to remind everyone to review the ONC's Cures Act Final Rule page. There you can access a copy of the final rule, along with a number of very useful fact sheets, ONC webinar recordings, and a lot of other really beneficial resources. So registration date to sign up for testing certification to any of the new or revised criteria under the Cures Act. It will be announced soon, so Drummond will be sending out a communication to our clients once that's finalized, so please look out for that. Also, if you have any questions, which I'm sure many of you do, about the rule, testing, technical questions, we encourage you to send them our way. You can log into our Drummond customer portal, send us a message, or email us at certification@drummondgroup.com. Just a final reminder, again, please do register for our upcoming webinars. We have one each week for the next 4 weeks. And if you are unable to attend, we will be posting those webinar recordings to our website.
Thanks, Sonia. And yeah, just to reiterate, we're going to email out a link for the recording and the slides for everyone that attended today. I want to hand this off now to Timothy. Timothy, you're our test lab director. You've been answering some of these questions live, and I'm going to hand the floor to you just to answer any of the questions that you saw that might need to be addressed or might need more clarification.
Yeah, yeah. Thanks a lot, Melissa. And so I'm gonna kind of I tagged a few of the questions that came in that I thought maybe I would throw out to Sonia and have her kind of clarify or go into a little bit more detail. Sonia, we had a question if you could kind of go back and explain D12 and D13 again, briefly.
D12 and D13. All right. And let me pull up the slide here too. Okay. That was likely the ASTM update.
And also that too as well. So D12, okay. D13, and yeah, kind of talk about the impact of ASTM as well.
Okay. Yeah. So D12, excuse me, D2, D3, and D10. So these were revised criteria, and the revision is solely based on the implementing the updated ASTM standard. So what I was mentioning earlier is that standard includes a requirement for an auditing requirement for duration of access. And so after review, and again, we got some inquiries about that, because it was initially communicated as an insignificant change, we thought that is actually going to be a significant change for developers if they are expected to start capturing that additional date timestamp. So it's not just capturing when it was accessed, but when the auditable event, you're capturing the duration of access. So that could be very different. So that was a question that we posed to the ONC. If we can get clarification on that. So they are working on finding that out for us. And so we will be communicating that clarification as soon as we receive it.
Okay, and can you just go over what exactly D12 and D13 are again, please?
Oh, I'm sorry. I'm so sorry. I'm on D2.
Well, no, that was a question too, Sonia. So it says,
okay. Let's back up. Yeah.
Sorry. Yeah. So we had questions on ASTM as well.
Thank you. All right, good. D12 and D13. Those are new criteria. Sorry about that. So D12 encrypts authentication credentials, and D13, the multi-factor authentication. So these are done by way of attestation So as we explained earlier, if the health IT product does not already have these features, it's not going to be any negative impact on your certification. So you're simply attesting to if the product has these features. So it's not a live test. It will be done via attestation, but it is a requirement. So everyone will need to attest, whether yes or no, if they support these features. So for D12, it's encrypt authentication credentials. So that's if your product encrypts stored authentication credentials. And then for D13, if the multi-factor authentication, if you support that within your product. Sorry.
That's great, thanks. Another question that we have is with respect to, here, let me find it. Regarding the communications requirement that you were discussing towards the end of your presentation, I think you mentioned that is beginning in 2020. Just some clarification on, does that mean like on the effective date of the rule or by the end of 2020, or maybe just provide a little bit more?
Yeah. Okay. So so for the compliance period is expected to start June 30th. So this is where a developer would not be permitted to prohibit or restrict certain communications about their health IT product. So compliance with that starts on June 30th. Now, as far as notifying customers, that is expected to begin this year. But again, the enforcement discretion period, I want to highlight that does apply. So that notice to customers, if that, I want to clarify, that could even start later in early 2021. But it's expected that developers would notify clients by written notice that they will not be enforcing any agreement that goes against that ruling.
All right, thanks. And regarding these attestations of maintenance of certification and continuance of certification requirements, like the records retention and whatnot, will there be templates of these attestations that will be available to our customers?
We are expecting ONC to provide some more guidance on that. I don't know if it's going to be a template necessarily, but ONC had planned on providing more guidance on how that should be submitted. Here at Drummond, we anticipate the process to be similar to our quarterly attestation process, where developers are able to log in, answer a couple questions, and just authorize that as their submission. But again, just as we get that guidance from ONC, we'll be sure to communicate that.
Okay. I have a question regarding EHI. When you were talking about EHI, what was the situation for when they must be able to support export anytime without developer assistance versus with developer support? Do you have any, can you clarify any comments on that?
Yes, let me go back to that slide. So for the single patient exports, this is a process that the user should be able to do at a time they choose. And this should not require developer assistance. So this would just be a single patient export. Now the patient population export, this one can rely on developer assistance. So this is a change from B6, because B6 requires the data export. It requires currently that developers should not have to assist with any export. So for patient population export under B10, this can be performed with developer assistance.
Okay, great. Thanks for that clarification. let's see. So the conditions of certification, is this required by all who are currently certified for 2015 or only for those who will be implementing the new changes in 2021?
I'm sorry, can you repeat the question? This is related to B10 still?
No, I'm sorry. This is a new topic. Back to the conditions of just the general conditions of certification, the COC.
Okay.
Is this required for everyone who is currently certified for 2015 or only for those who will be implementing the new rule changes in 2021?
No, this applies to everyone. So this will be your compliance dates. And just again, another reminder, the enforcement discretion period is available if needed 3 months after compliance date. So starting in June 30th, on the effective date of the rule, the compliance to assurances and communications is required. No submit a document or anything, just the practice comply.
So Sonia, if I'm an EHR developer and I've already got a certified 2015 edition product, I have to be compliant with these conditions of certification, even though I haven't yet implemented or certified any of the new or revised criteria from the final rule, correct?
Yes, so
All right. One final thing from me. We had a request if you could go back and show slides 1 and 2 again.
Oh, we may have lost Sonia, actually. It looks like her audio went out, so this might be a good time to just wrap it up.
Yep.
She was breaking up at the end. So again, we are going to make these slides available to everybody, and we're going to email them out this week, and you'll be able to download the slide deck as well. So we'll get back to all the questions that were asked that weren't answered live or weren't answered during the webinar. So we'll email you we'll send an email to you with the answers to those questions. I want to thank everyone again, and please stay safe and stay healthy. Thanks, everyone.